will continue with deliberations of item 5G, accelerating primary health care in the WHO European region, organizational and technological innovation in the context of the Declaration of Astana. This item is considered in documents EUR/RC69/13 Rev 1, EUR/RC69/13 Rev 1 Add 1, and EUR/RC69 Conf Doc/9 Rev 1. I understand that there have been some informal consultations on this resolution in the last days, and there is an agreed text. I have asked the Secretariat to provide you with this text. We will first have the discussion on the item now, and then I will come back to you on how I propose to proceed. 2018 marked an important milestone of our commitments to primary health care as an approach and model of care for our people. Our European region has been at the forefront of innovations, and today we have an opportunity to continuing in this direction, looking at 10 evidence-based policy actions that are accelerators for primary health care. Firstly, let us watch a video illustrative for this topic. The video, please.
Диагноз рак молочной железы мне поставили в августе 2002 года. И в октябре мне пришлось пройти операцию хирургическую по мастектомии. Я вот тогда приехала к маме, на меня так смотрит, а я, вы знаете, из сумки достаю все эти свои снимки, эти все свои выписки, которые мне сказали еще носить их все время с собой, вдруг с вами что-то. И я говорю, открывай, мама, эту печку, говорю. И она такая, знаете, с ужасом на меня смотрит, а я так открываю и все туда швыряю. И мама говорит, ты что делаешь? Тебе же еще инвалидность оформлять. Я говорю, мам, никакой инвалидности, никакого рака, ничего больше у меня нет. Все, мам, пошли в баню. Совершенно случайно в 2009 году, будучи уже таким известным общественным деятелем у нас в стране, меня попросили как общественного наблюдателя вступить в одну комиссию. И я была в этой комиссии просто по проверке деятельности одного из детских домов. И там, к сожалению, я столкнулась с тем, что я увидела мальчика, который болен раком. И у него была уже последняя, 4-я стадия, и ему практически не оказывалось никакой помощи. Никто его не хотел брать в клинике. К сожалению, этот ребенок умер потом. И, в общем-то, вот именно смерть этого ребенка, будем так говорить, без ухода, без ласки, без внимания, без заботы, очень сильно тогда меня так вот перевернуло. И я стала просто изучать эту проблему детской онкологии, вопрос адвокатирования детской онкологии. Поняла, что эта ниша настолько открыта, и никто ее не хочет занимать. Мы поставили за себя такую цель – открыть первый центр паллиативной помощи детям с онкологическими заболеваниями. Центр паллиативной помощи детскому населению, вот, который мы здесь открыли на базе этого домика, который нам подарили. Здесь у нас стационарно 16 коек. Вот, и он оснащен всем необходимым для того, чтобы здесь выхаживать даже самого тяжелого уходящего ребенка.
Сам съел. О, молодец. Да.
Учитывая менталитет наших казахов, тех, которые считают, что ребенок последние дни жизни должен быть дома, в кругу семьи, в кругу своих родных и близких, в родных стенах, чтобы до последнего момента у родственников была возможность его обнять, поцеловать, приласкать, сказать ему какие-то последние слова любви и ласки. И я из уважения к этим чувствам, к родительским, я поняла, что мне нужна теперь такой проект, который будет двигаться к ним. Не они ко мне, а я к ним. Я к ним со своими услугами, со своей любовью, со своей заботой, вниманием. И вот родилась идея вот создания такого замечательного проекта, как выездная мобильная служба. Мы стараемся до сих пор всеми силами организовать этот домашний стационар. По возможности оказывать на дому всю медицинскую помощь. Инъекции, капельницы, обработка всех пролежней, если таковые есть, питание ребенка. Мы обучаем мам делать инъекции, мы обучаем мам уходу за ребенком, мы обучаем мам, как правильно их питать и кормить этих детей. Мы обучаем всех ближайших родственников, которые помогают в уходе. И это очень важно. Когда у меня один раз что-то спросили, да зачем вам это надо, зачем вы открыли хоспис? Это же вот хоспис, что это, смерть, умирание. Это... Я говорю, вы знаете, я открыла хоспис для жизни. Для жизни. Вы вот хоть раз задумайтесь, что хоспис – это же жизнь. Это жизнь. Пусть день, да? Пусть неделя, пусть месяц, но это жизнь. Самое главное, какая жизнь? Интересная, кипучая, да? Качественная, без боли и без страданий. Я живая? Пощупай меня. Они меня щупают. Видишь, говорю, я живая, да. А у меня тоже, говорю, 2 рака было. Значит, я тоже буду жить, конечно. Вот пощупай, видишь? Почему мы и обнимаемся? Мы каждое утро обнимаемся. У нас утро начинается с обнимашек. Я всегда им говорю, я победила, мне тоже было плохо, мне тоже было тяжело, я тоже плакала, я тоже кричала, говорю, я тоже стонала, говорю. И что? Мне делали 2 огромные операции, меня несколько раз спускали, как это называется, да, с радуги. Я несколько раз была на радуге, я несколько раз уходила, меня возвращали. И если я вернулась, ну, наверное, так Богу угодно. Наверное, так угодно Богу. И вы знаете, когда я им это говорю, они мне тоже так вот сидят и говорят, а я тоже был на радуге, когда мне химию делали. Я вот, видишь, ну мы же с тобой вернулись, да. Ну, значит, нам еще рано с тобой туда.
Thank you. What a video. What a video. Now, I would like to give the floor to Dr. Santino Severoni, Acting Director, Division of Health Systems and Public Health, and Dr. Anne Johansen, Acting Head of the Geographically Dispersed Office, to make a short introduction. Dr. Severoni, you have the floor.
Thank you, Mr. President, Regional Director, delegates. It is a matter of fact that in the European region, all member states have advanced in the implementation of primary care. However, today's health and health system challenges require policy effort to ensure system alignment and expansion of coverage of quality services and financial protection for the strengthening of primary health care. 2018 was an important year. WHO member states renewed their commitment to strengthen primary health care with the endorsement of the Declaration of Astana. Those commitments are rooted into the principle of the Declaration of Almata and emphasize the central role of primary health care to achieve universal coverage, but also the Sustainable Development Goal by 2030. The global commitment to primary health care renewed the Declaration of Astana need to be transformed into visible actions and tangible changes. With this intention that the WHO member states requested WHO Director General to develop in consultation with all regions and by the 73rd World Assembly, an operational framework for primary health care to be taken fully into account in the WHO Global Programme of Work 13 and budget to strengthen health system and support countries in scaling up national implementation of primary health care. The operational framework, Primary Health Care Transforming Vision to Action, aims at proposing the levers needed to translate the commitment made in the Declaration of Astana into actions and interventions that can be used to accelerate progress in primary health care. This report proposed 10 evidence-based policy accelerators for strengthening primary care in the WHO European region. The policy accelerators, based on the best available research and practice, highlights high-impact entry point for rapidly advancing progresses in primary health care. The aim of the policy accelerator is to provide guidance to countries in prioritizing evidence-based innovation and scale-up implementation of primary care. The policy accelerator for strengthening primary health care builds on the European Framework for Action on Integrated Health Service Delivery endorsed by the WHO Regional Committee for Europe in 2016 and will be aligned with the levers of the operational framework for primary health care when adopted by the 73rd World Health Assembly. And with this, I would like to briefly pass the floor to my colleague Anne Johansson, acting head of the WHO European Centre for Primary Health Care, Almaty, to provide you a bit of insight on the document. Thank you very much.
Thank you, Santino, and thank you for giving me this opportunity to talk about something that is very close to my heart. The video we just saw gives you a really good sense of the importance of primary care, because ideally, with proper primary care, we wouldn't have so many children dying from cancer at a stage where it's no longer curable. So primary care is the foundation of all of our healthcare system. I mean, it's as simple as that. And what's really interesting to me is we all talk about how historic declaration was, because while it was important in those days, the burden of disease was quite different. And I would argue that today, it's even more important to have primary care because of the global burden of disease due to non-communicable diseases. Those are simply not well manageable by investing in hospitals. And unfortunately, what you see in many countries is that politicians, confronted with this growing burden, invest in hospitals. And yes, you can reduce mortality by investing in hospitals. It's just that it's very costly and it's not very effective. So primary care is even more important than it might have seemed in 1978. And it's for that reason that the Declaration of Astana from last year is so critical, because it committed countries to making bold political choices across all health sectors, to building sustainable primary health care, empowering individuals and communities. And I want to say something just a little bit that you may think that empowering patients and communities is not the role of primary care. But when it comes to NCDs, when it comes to outcomes of NCDs, the role of patients and the role of communities in which they live is as important, perhaps even more important than what happens at the doctors. So that's part of the paradigm shift that we need to make, that we need to move from healthcare to health and from health facilities and doctors to focusing on outcomes, which then necessarily gets you to focusing on patients and communities. Now, we've already talked a little bit, Santino already mentioned the starting from last year and all the steps that are on the road, so I don't want to spend any time on this. I do want to highlight the foundation of the accelerators that you are here to vote on today is they are based on evidence. And it is incredibly important as we move forward that the investments countries make in their primary care are based on evidence, because otherwise we will end up wasting very scarce resources and foregoing the kinds of outcomes that we want. And the evidence comes from a variety of, country studies, from research, from journal articles, case studies on good practices, country and expert experiences, working across the different parts, the work on health systems and non-communicable diseases that you know so well. It has been a very big body of evidence to put together, even though it's only a short list of policy accelerators. Now, here you see them very briefly, and I won't go into all of them. And Santino has already mentioned that these are intended to provide guidance for countries that want to scale up their primary care, improve the performance of their system, and as an essential step towards universal health coverage. But I want to highlight that when you look at these things, only a subset of these policy accelerators actually focus on care itself. Many of these things focus on health systems components and things like aligning accountability and incentives, integrating health and social care, making healthcare accessible across the life course, supporting patients to take responsibility for their health. And I think this is really important. We cannot achieve good primary care outcomes without thinking in systems and outcome mechanisms. Now, I want to give you just a little bit of background on the origins of the policy accelerators, because there seems to be some confusion about why are we having accelerators and why are we using the word policy accelerators when the operational framework from the Astana Declaration uses policy levers. And so I thought it would be very important to highlight that, as Santino already mentioned, this grew out of a directive or a request from the regional director in 2016 for WHO to really start scaling up our technical work on primary health care. So this work predates the Astana Declaration and all the work that has gone in there. Now, you might ask yourself, well, why didn't we see it before? Well, part of it was because the staff at the Almaty Center then actually were seconded to work on the organization of the Astana conference. So it got delayed. And so for this reason, we are here today. I would argue that we should not focus or worry so much about the terms of policy levers, policy accelerators. And we are going to be moving towards, operationalizing or adapting the operational framework in the European region once we have digested and analyzed the responses from the consultations. What these are is these policy accelerators are useful because they are based on the best evidence that's out there. So I see it as a complement. We are ahead in so many ways in the European region, and we have had the advantage of being able to benefit from the experience and the evidence about what works and what doesn't work. So the resolution commits member states, all of you, to prioritize the healthcare approach. This is very consistent. You've already done this both all the way back to 1978 in the Alma-Ata Declaration, but of course, very recently in the Astana Declaration. It reiterates that it is placing people at the center of the health system, and for reasons that I just mentioned, it is the patient who becomes his own provider, he becomes the expert patient. So we have to organize our health system around that to enable patients and people to take responsibility for their health and managing their diseases. And an integral part of that is measuring and monitoring impact, performance, and capacity, because unless we know where we are, we have no way of knowing where we're going or whether we got there. So this is an essential aspect. And then, as I already said, we have these advanced evidence-based high-impact policy actions that will be part of the evidence base going forward. But it is not the end of things. We will continue to work in this area. So the regional office with this resolution will be offering a variety of support to countries wishing to have this support through technical assistance, health intelligence on primary care, partnership, knowledge sharing and learning, strategic guidance, policy dialogues, etc. So this is the categories, but I also wanted to highlight just a little bit about the European Center for Primary Care in Almaty, which I am heading now. We will be leading the efforts to adapt the operational framework to the European region in consultation with headquarters. And we will make sure that there will be alignment of the policy accelerators with the operational framework. But I am not worried about that because there is nothing inconsistent if you actually look at the content between the policy accelerators and the operational framework. Some of the things that are in the operational framework are not in ours because we already have integral policies. Health 2020 already has been in place for since 2012, incorporating aspects of what is in the operational framework and other aspects like research on primary care. We already have that. This is not an obstacle or bottleneck. So there is no technical inconsistency between them, but we will make sure that we take forward the operational framework to make sure that we have consistency with the global action framework or the global operational framework. And then we will also contribute to WHO's efforts to monitor the implementation of the Astana Declaration because, as I just said before, unless you monitor where you're going, you will not know whether you will get there. So this is what we look forward to and what we will be doing. But before I end, I want to leave you with a number. 35.4 million years of life were lost in 2017 in the European region due to high systolic blood pressure. We don't have exact numbers of how much this costs. We could probably make some calculations, but you're likely to have very high costs based on this. But I want to leave you with the magnitude of this number just due to high systolic blood pressure. This is something that is at the heart of primary care. We know how to diagnose blood pressure. We know how to treat it. we are having a hard time managing it, but it isn't even costly. So and this is responsible for, it's responsible for 21% of all premature mortality in the European region. If we only do one thing while we start building all the system aspects, focusing at the same time on trying to measure, treat, and manage hypertension, we will have made major progress. And so as part of our effort to monitor, evaluate, I very much hope that we can start with measuring and monitoring systolic blood pressure so that we can make the kind of impact we all hope for, because it will be considerable. Thank you.
Thank you very much, Dr. Severoni and Dr. Johansen. Let me now open the floor for discussion. I now ask delegates wishing to speak to raise their name plates. After the second speech, I will read out the list. I see Republic of Moldova, please, followed by Slovenia.
Thank you very much, Mr. Executive President. I am Minister of Health, Labor and Social Protection for the Republic of Moldova, and I would like to emphasize some things in relation with primary health care and how to accelerate this. So based on the experience of Republic of Moldova and conclusions of different reports conducted by other countries in the region, I would like to mention some very important links of primary health care accelerators to financial protection. Most countries in the WHO European region offer universal population coverage, but many people still have to pay out of pocket for need health services. Poor people and those with chronic conditions are therefore particularly likely to face financial barriers to accessing health care. This widens the health divide within and across countries. In many countries in Europe, including the Republic of Moldova, payments for medicines are currently the main cause of financial hardship for citizens. The models of national health systems are very important for accelerating primary health care. As an example, the introduction of the mandatory health insurance in the Republic of Moldova back in 2004, combined with the reorientation towards primary care of a previously very hospital-centric system, has helped to increase population access to essential health services. And we do not forget about political will and leadership. Moving towards universal health coverage requires strong political commitment and leadership, particularly in context with limited available economic resources call for hard political choices. To make health for all a reality, supplementary to the individuals and communities who have access to quality health services so that can take care of their own health and the health of their families, skilled health professionals providing quality and people-centered care, we need to have policymakers committed to investing in primary health care. And policymakers should enable a shift towards existing coverage to the whole population, removing financial barriers to cost-effective care, and investing in efficient, equitable, and high-quality health services. Thank you.
Thank you, Moldova. Slovenia, please, followed by Spain.
Thank you, Mr. Chair. I cannot more than agree with what has just been said by my colleague from Moldavia. And I would say that when we are speaking of primary health care, we should understand that we are speaking of inequalities and how to actually tackle those. We should understand that we are speaking of sustainability of our health systems, that we are also speaking of access to qualitative care, and we are also speaking of, at the end of development of our countries, our regions, our communities, And we have heard in our conference in Ljubljana on inequalities that investing in health is contributing to GDP even, and as I said before, development at all levels. I think that also primary healthcare services are where we can exercise preventive and promotive services best, together with public health, of course. And being aware of all of this, I can clearly see that investments will be needed in the future. And here, in line with what has just been said by Moldova, I'm not going to ask you to do something about it, because I know you cannot. I mean, it's upon the countries, and unfortunately, we are convinced here, but maybe our finance ministers are not. I would rather ask you, how are you going to put these messages on the agenda of all the forums of OECD, of G7, of G20, name it, so that also those who decide upon prioritizing investments in the countries would understand what is at stake. Thank you.
Thank you, Slovenia. As I told you, I read out the list. Spain, France, Hungary, Israel, Malta, Montenegro, and Sweden. Spain, you have the floor, and Russian Federation. Spain, you have the floor, followed by France.
Thank you, Chair. Spain welcomed this agenda item given the currents of the demographic, epidemiological, and technological evolution context. It is necessary to give a new impulse to accelerate primary health care in order to renew its leadership as the axis of health systems. In answer to the current challenges, Spain has initiated the implementation of the strategic framework for primary and community care. This framework is the result of a collaboration process among all involved stakeholders, including central and regional administration, health professionals, and patient associations. Its framework aims to reinforce our already well-established primary healthcare system by setting clear and concrete short, mid, and long-term goals grouped in 6 strategic lines. Among these lines, we give importance to strengthen governance, human and financial resources, coordination, and health prevention and promotion. Besides, our framework covers and addresses information technologies and systems already strong but in continuous development. Last, we believe also in promoting capacity and research of primary health care. Spain works hard to continue to have a strong and resolutive primary health care, being aware that there are new challenges. Therefore, we appreciate the current report we are discussing today and look forward for the future global framework currently under consultation. Thank you, Chair.
Thank you very much, Spain. France, please, followed by Hungary.
Merci, Monsieur le Président. La France remercie le Bureau général pour son rapport sur l'accélération du renforcement des soins de santé primaire, ainsi que les innovations organisationnelles et technologiques proposées pour la région européenne de l'OMS. Comme nous l'avons dit, les soins de santé primaire sont la pierre angulaire d'un système de santé durable. Accélérer leur renforcement pour atteindre la couverture santé universelle et les objectifs de développement durable impose d'améliorer le partage des connaissances. À cet égard, je voudrais rappeler qu'aider à mutualiser l'expérience des pays a été au cœur des débats de la présidence française du G7 et a donné naissance à l'initiative du G7 pour des connaissances communes sur les soins de santé primaire. Cette initiative vise à encourager un apprentissage croisé entre tous les pays intéressés, quel que soit leur niveau de développement. Pour sa mise en œuvre, 5 organismes internationaux se sont engagés conjointement, sous la coordination de l'OMS, à préfigurer la mise en place d'une plateforme entrant dans le cadre du plan d'action mondial pour la santé et le bien-être de tous. Les organismes internationaux remettront leurs travaux à notre ministre des Solidarités et de la Santé en marge du prochain comité santé de l'OCDE, le 12 décembre prochain. Dans ce contexte, la France salue l'engagement du Bureau régional sur les soins de santé primaire et soutient ce projet de résolution. Je vous remercie.
Thank you, France. Hungary, please, followed by Israel.
The Regional Director, Chair, Honorable Ministers, distinguished delegates, dear WHO colleagues. The Hungarian government fully supports the commitment and policies of WHO Regional Office for Europe to promote an inclusive and effective approach to strengthen primary care, also in the light of Declaration of Astana. We are convinced that strong primary care is the key factor to build up integrated healthcare services. In the recent years, especially since 2010, a great deal of new policy interventions have been implemented with the aim of strengthening primary care in Hungary. The public expenditure for primary care has been raised by 70% from 2010 to 2018. A set of new performance indicators were launched to assess the process of screening, prevention activities, management of chronic diseases, and prescription habits. Though universal coverage by primary healthcare services is guaranteed by law, regional inequalities exist. To decrease the regional differences in access to services, targeted financial incentives were launched to support the move of doctors in those practices located mainly in remote areas. Furthermore, Hungary initiated a number of new policies that are focusing on disadvantaged communities with the aim to provide a higher range of services, mainly prevention, enhanced community orientation, with special attention to the Roma community. As a recent development, a new program titled 3 Generation for Health has primarily been dedicated to increase the number of healthy life years to prevent childhood obesity and smoking, to promote smoking cessation, to prevent early mortality due to the cancer, coronary disease, and stroke, and to stop the increase in the prevalence of diabetes and obesity. The program finances both universal and selected targeted interventions with the cooperation of primary and secondary health providers, as well as health promoting offices with the support of local governments. Increase the range of services implies working with other healthcare professionals like dietitians, psychotherapists, and psychologists in a coordinated way among GP team members. Lastly, the establishment of the national e-health infrastructure in 2017 is another important step forward. From 2019, the introduction of unified medical record will support general practitioners to identify and assess the risk factors of their patients. Thank you for your attention.
Thank you, Hungary. Israel, please, followed by Malta.
As we are for the last 25 years reforming continuously our system and shifting service from hospital to community-based primary care with quite a lot of success, and actually our primary care system seems to be even better than our hospital system. I would like to mention 7 main points in our view, which is related to this resolution, which are essential, at least by our experience, to achieve a decent primary care services in each country. The first one, of course, is obvious, and that's commitment of all stakeholders, mostly of government, but also medical association, public, and other associations and lobbies. We, ministries of health, could not change or make any shift without convincing our public that it is feasible, makes sense, and it would create better health. We did it 25 years ago in a unique scenario, which helped us to change the law in Israel. Second, no public healthcare system, no primary healthcare system could exist without adequate budget, which is relevant to each country. But feasible budget means that you can't, with 2 or 3% of your GDP, expect to get decent primary healthcare in your country. A lot should be done about it. And I would say also that the third point would be that you could not anymore rely on fee-for-service reimbursement. We have to look for incentivized system, as my Hungarian colleague said, and a few others. And at least in our country, it is a combination of, I would say, capitation plus incentivized payments to push our healthcare giver to give a much better service with better impact. Fourth, no parallel payments could exist, and I mean both out-of-pocket payment as well as under-the-table payment. We have to find a way to pay adequately our healthcare giver, mostly our physician, on the other hand, to fight fiercely against any type of corruption inside the system, which would not really allow any primary healthcare system to thrive. The next step would be, in our point of view, to have a clear evidence-based benchmark of a set of indicators to decide exactly what should we do, how should we do, where to put our effort, and where it is not a good idea. I would say blood pressure, high blood pressure was mentioned here before. Diabetes would be the same, and few other issues, including issues of cancer screening that I would be happy to elaborate later. The fifth or sixth point would be education and training of our healthcare giver, mostly our physicians. To be a primary doctor doesn't mean that you could continue be a simple structure of a GP. It has to have a proper postgraduate training, a specialty system with exams, and you have to be consistent that your doctor knows exactly what to do in various situations and cases, and if also feel proud in his specialty. The last point is quite an elusive point, and it is in the resolution. Technology and digital health seems great, but both are misleading and could be elusive and not necessarily the first step that countries should take. It is expensive, it is a long-lasting process, and in many cases, you first have to I would say, solve the previous issues before you spend a lot into digital health. And digital health could do a lot, but we have to understand the proper context of it. Thank you very much.
Thank you. Israel, Malta, please, followed by Montenegro.
Thank you, Mr. Chair. Last year, building upon the principles of the Declaration of Alma-Ata, Member States renewed their commitment to strengthen primary healthcare with their endorsement of the Declaration of Astana, another salient milestone for primary care on a global level. As the first level of care and contact of people with health systems, primary healthcare is a necessary foundation for universal health coverage and the health-related SDGs. And placing it at the center of efforts to improve health and well-being are critical, especially to help us respond to the complex and rapidly changing world we live in. Malta welcomes with interest the compilation of policy accelerators for strengthening primary healthcare, particularly the digital pointers. Digital technology has immensely changed our society, with faster developments and innovations also allowing health systems to offer more effective and efficient healthcare delivery. The 3 Ps, prevention of avoidable illness, health protection, and promotion of well-being, go hand in hand with and are addressed by the 4th P, primary healthcare. In strengthening primary healthcare to deliver excellence, a highly capable human resource together with the right infrastructure are needed. To enable innovative primary care provision, Malta has embarked on a holistic reform to reposition public primary healthcare at the center of a more sustainable national health system. A chain of initiatives and projects will revamp the system to offer a better healthcare service, free at the point of use, with improved access to quality care across the life course. Innovations in organizational design and the introduction of new and re-engineered patient-oriented services will more effectively and efficiently meet the evolving needs of the Maltese population. The construction and development of 2 regional primary healthcare hubs will offer a number of new specialty services, complementing the refurbishment of existing infrastructure. However, more important is the empowerment of healthcare professionals to ensure that the primary healthcare workforce has the knowledge, skills, competencies, and capacity it requires. Malta supports the adoption of the proposed draft resolution on accelerating primary healthcare strengthening. Keeping in mind the complex interplay of factors that lead to improved health and well-being, and concurring with Slovenia's closing remarks, we believe that the WHO Regional Office is well positioned to provide clearer guidance, spearhead and advocate for increased multi-sectoral policy and action as a key component to further strengthen primary healthcare and public health. Thank you.
Thank you very much. Montenegro, please, followed by Sweden.
Thank you. Your Excellencies, Madam Regional Director, Honorable Ministers, ladies and gentlemen. It's my pleasure to speak on behalf of 9 member states of SEE Health Network. Currently, the Southeastern Europe Healthcare Network is implementing the strategic document, the Sub-Regional Cooperation Strategy 2018-2023 document, which supports the achievement of the SDGs and the SEHN Chisinau Pledge. Universal health coverage is one of the key priorities, and thus primary health care is one of the key drivers in the pursuit, and according to the principles of Declaration of Alma-Ata and Astana. This has been subject of special attention during this year. In relation to this, I would like to mention that the main initiative started in partnership with the government of Slovenia, and the first expert meeting on the value of primary healthcare systems strengthening in Southeastern Europe regional workshop held in Ljubljana, Slovenia in October 2018. The first step was to have mapped and current primary healthcare system and recent reforms in Southeastern Europe countries. After discussion on the preliminary findings, countries decided to embark on in-depth research in the CE region. In the last decade, life expectancy and health expenditure have increased in our countries. However, looking deeper, there are many differences across the CE region, pressing challenges as the aging population, increasing burden of non-communicable disease, raising expectations towards health services and system, human resources challenges determine a high degree of complexity towards common policy recommendations. In this respect, with the great support of the WHO European Centre of Primary Health Care in Almaty, it was decided to launch a trans-regional study using the tool for monitoring impact, performance and capacity of primary health care in the WHO European region that will allow to have a 360-degree snapshot of the primary health care in the Southeastern European region. The study gives us the opportunity to depict every dimension of the primary health care system: governance and management, financing, human resources, organization of providers and services, system outcomes, and primary care outcomes. The study is at the data collection stage in almost all the countries. We expect during the first quarter of 2020 to have conducted validation and expert consensus of the extracted data at all national levels. Continued effort to study primary health care in the Southeastern Europe countries is found extremely timely and relevant. The network is committed to supporting its member states and to ensure that the Southeastern Europe countries are the forefront of primary healthcare strengthening efforts. In this context, I'm thrilled to have the results of the comparable data on the primary healthcare in the Southeastern Europe region to boost health intelligence for decision-making process. Ladies and gentlemen, finally, I would like to call our main partner, WHO Regional Office for Europe and its Center on Primary Healthcare in Almaty, to continue supporting us to implement proposed accelerators, policies, and as an essential platform to advance toward universal health coverages and SDGs. Thank you for your attention.
Thank you, Montenegro. Sweden, please, followed by Russian Federation.
Thank you, Chair. Primary healthcare is the type of health service that most people meet, and it needs to be accessible for all during the course of life. This is important because life expectancy has increased in the last decades in Sweden as elsewhere. 20% of the Swedish population is now over the age of 65. The increase in life expectancy since the year 2000 is primarily due to reduced mortality after the age of 65. The largest increase is found in the group 80 years and older, where the number is expected to be doubled by 2045. This is, of course, a challenge for the provision of healthcare. Primary care should play a central role in healthcare systems. Research shows that stronger primary care can contribute to a more equal health throughout the population. It is also important that the primary care sector coordinates their work with social care and social services for the benefit of the patients and their families. Effective collaboration between primary care and social services is essential for women and men in order to support their needs. In older age, chronic diseases and complex health problems are more common, as well as the use of many different medicinal products at the same time. To prevent chronic diseases, the National Board of Health and Welfare has published a national guideline for the prevention and treatment of unhealthy lifestyles in healthcare, not least in primary healthcare. In international comparisons, Swedish healthcare is of a high standard in terms of medical outcomes. However, if Sweden is to maintain or increase the quality of healthcare, address demographic developments, and at the same time control the costs, changes to the structure and organization are required. Primary healthcare needs to be reinforced to ensure continuity of care, patient participation, and timely access. The government has therefore initiated a large-scale restructuring of the Swedish health system with a focus on strengthening primary care. This work includes extra monitoring in order to ensure that patients or other parts of the healthcare system are not negatively affected. This resolution will support our reform efforts. We thank the Secretariat for their work and timely report, which underlines the importance of an accessible and high-performing primary healthcare system. Thank you.
Thank you, Sweden. Russian Federation, please.
Спасибо, господин председатель. Российская Федерация благодарит ВОЗ за подготовленный отчет. Первичная медико-санитарная помощь – это основа эффективной системы охраны здоровья и здоровья общества в целом. В Российской Федерации охрана здоровья населения строится на закрепленном в Конституции праве гражданина на бесплатную медицинскую помощь. Данное право реализуется в рамках программы государственных гарантий и системы обязательного медицинского страхования, согласно которым каждый гражданин с момента рождения и на протяжении всей жизни обеспечен практически полным пакетом медицинских услуг. Вместе с тем, перед всеми нами стоят проблемы кадрового обеспечения, задачи по обеспечению медицинской помощи населения, живущего на удаленных территориях, обеспечение максимально возможного качества медицинской помощи, а также принятие эффективных решений в рамках существующих ресурсных ограничений, а также задача полноценного сопряжения усилий по укреплению первичной медико-санитарной помощи с принципом межсекторального взаимодействия, особенно в контексте борьбы с факторами риска на индивидуальном и популяционном уровне, требующих активного вовлечения других секторов. Российская Федерация активно поддерживает работу ВОЗ по укреплению первичной медико-санитарной помощи. Спасибо.
Thank you very much, Russian Federation. No other delegates asking for the floor. I can give the floor now to NGOs and for short statements, and I please ask the International Society of Physical and Rehabilitation Society for a joint statement with many other organizations. You have the floor.
Hello. The International Society of Physical and Rehabilitation Medicine, WCPT, AAPO, Studio Room, WHPCA, COTEC, WFOT, UFA, EFAD, and EFPC celebrates the regional committee's approach to accelerate progress in primary healthcare in the European region, especially the fact that rehabilitation is considered as a key strategy to achieve universal health coverage and the importance of assessing the special needs of persons with disabilities. Rehabilitation, as defined by WHO, is a health strategy that aims to optimize function, reduce disability, and ultimately contribute to well-being. Rehabilitation needs are increasing due to non-communicable diseases, chronicity, injuries, and aging. Persons with disability have the greatest difficulty in accessing health services. Basic rehabilitation services, assistive technology, and long-term follow-up should be reachable for people experiencing disability, but rehabilitation professionals in primary health care are scarce in most countries. We strongly believe there is a growing need to know the patient's functioning problems and rehabilitation needs in primary health care in Europe, in addition to building the necessary strategies to respond adequately to these needs, considering the particularities of the provision of rehabilitation services, which may be more difficult to apply some strategies such as the redistribution of tasks, telehealth, and telecare. Moreover, the rehabilitation approach illustrates clearly the need for a paradigm shifting in healthcare from a disease-oriented towards a goal-oriented approach, aiming at the realization of the life goals of the patients. Thank you.
Thank you very much. And now the joint statement of the International Council of Nurses and the European Forum of National Nurses and Midwives.
Thank you, Chair. Distinguished delegates, my name is Karen Bureau and I'm a nurse, and I speak on behalf of the International Council of Nurses, the European Forum of Nurses and Midwives Associations, and the European Nursing Students Association. Nurses and midwives are committed to the fundamental right of each individual to the highest attainable standard of health through universal health coverage based on people-centered primary health care. We urge governments to accelerate the transformation of health systems to a primary care focus in order to grapple with the pressing health and social challenges of our populations. Nurses and midwives work close to people's homes and workplace in the community and are critical to empowering individuals, families, and communities to be owners and advocates for their own health. Nurse-led and midwife-led care models can contribute to universal health coverage, and it has been found that when nurses and midwives practice to their full scope in team-based primary care settings, it is cost-effective, improves quality of care, and increases patient satisfaction, access, and equity. However, given the growing workforce shortage, we call for increased investment in nursing and midwifery education and improved practice environments. Decent working conditions and remuneration are critical to recruit and retain staff, as stated in the Astana Declaration, and deserve greater emphasis in the document. The WHO Euro Office has a key role to support member states to develop primary health care, and we appreciate opportunities in recent years to collaborate with the regional office to advance this agenda, and we look forward to further collaboration. Thank you.
We thank you. And now the intervention of Medicus Mundi International.
Thank you, Chair. This statement is by Medicus Mundi International is supported by the People's Health Movement. We welcome the commitment of the Regional Committee to strengthen primary care. However, we consider that the current vision presents several limitations. In the Astana Declaration and other recent WHO documents, primary care is portrayed as a means to attain universal coverage. However, unlike comprehensive primary care, UHC is silent on social determinants of health and on community participation. It also falls short of asserting access to health care as an entitlement. Further, universal coverage does not adequately address the links between ill health and inequity, including commercial determinants driven by the power of transnational corporations. Universal coverage relies on partnerships with the private sector, including health insurance schemes and public-private partnerships. We remind member states that such partnerships reduce accessibility and quality of care, while insurance-based models of universal coverage are often promoted at the expenses of funding public health programs. Their highly selective nature leaves many without the care they need. As we approach the UN high-level meeting this month, it is crucial that WHO bodies take into account differences between universal coverage and universal care. Along with comprehensive primary care, universal care represents the basis for fulfilling the human right to health. A selective version of primary care, as framed inside the universal coverage discourse, instead, keeps the door open for inequality in access and segmented models of service provision. We call upon member states to recall the regional concept of comprehensive primary care and ensure that any agreed regional accelerators, including those on digital health and other informed-based technologies, contribute to comprehensive primary care rather than meeting the needs of a privileged minority. Thank you.
We thank you, and now permit me to give the floor to the Regional Director of International Organization for Migration, Mr. Eriksson.
Thank you, Chair. IOM welcomes the draft resolution. We fully agree with the importance of primary healthcare also as a facilitator for universal healthcare access. We would like to underline the importance of including migrants, refugees and displaced populations into primary healthcare for all under the remit of universal healthcare access. Overcoming service fragmentation and improving the quality of services is in the interest of everyone. Inclusion of migrants in mainstream primary care is essential to avoid service fragmentation. IOM is committed to the 10 policy accelerators to support strengthening of primary healthcare. This includes establishing networks of providers to optimize integrated delivery system. It also includes using digital technology like electronic records to support continuity of care, as detailed as accelerator number 4. This particular accelerator seems vital when integrating vulnerable migrants into the healthcare systems of the destination countries. Great progress has been made to improve connectivity between healthcare providers and digital systems. This includes the IOM-developed electronic personal health record. This system is currently used by reception facilities for newly arriving migrants in 7 European countries. It has allowed effective communication between health providers concerned with the same patient. However, much remains to be done, and there is a need to better integrate these specific information systems to the wider health information landscape of member states. To conclude, I would like to reiterate the words of the draft resolution where member states are urged to place people at the center of their health systems by focusing on identifying health needs and tailoring services delivery interventions to proactively and equitably respond to these needs through the life course. IOM reaffirms its commitment to make this possible by advocating for inclusion of migrants, refugees and displaced populations. Thank you very much.
Thank you very much, IOM. And now I give the floor to the European Federation of the Association of Dietitians.
Thank you, Chair. I'm Annemiek van Ginkel. I'm the president of the European Federation of Associations of Dietitians, and we enthusiastically support efforts to accelerate primary healthcare in the WHO region and welcomes the recent WHO report on essential nutrition actions, which states that nutrition is a foundation for health and well-being for all, leaving no one behind, and a critical component of primary healthcare through its promotion and prevention, addressing its determinants and people-centered approach. Mainstreaming nutrition as part of integrated people-centered health services will put the comprehensive needs of people and communities, not only diseases, at the center of the health system and will empower people to have a more active role in their own health. It will also yield economic as well as public health benefits. Dietary treatment by dietitians is a cost-effective and often cost-saving investment. We have evidence that treatment by the dietitian more pays than for itself. In one analysis, for every €1 spent for dietary counseling, society has a net return of €14 up to €63 in return. Food and nutrition is an essential part of the healthcare process and the foundation of primary healthcare. The data show that dietetic interventions demonstrate statistically and clinically significant impacts on health outcomes. With the prevalence of NCDs in Europe, the result the resulting societal and economic consequences can be significantly reduced by dietitians due to their unique role and documented impact. With 35,000 dietitians across Europe, dietetics is a growing healthcare profession, which is good news for healthcare and public health. However, dietitians are not consistently represented in healthcare and still not exist in half of the WHO European region countries. This lack of integrated healthcare results in suboptimal care and unnecessary high costs. So, dietitians call on political leaders across Europe to allocate resources to mandate coverage of dietetic services within each country's existing healthcare system, to accelerate optimal nutrition in primary care and the WHO European region. Thank you very much.
Thank you. And now I give the floor to the International Federation of Medical Students Association.
Honorable Chair, distinguished guests, we are all part of a community whose main priority is the well-being of the patient. How do we reach the ambitious universal health coverage target by 2030? The International Federation of Medical Students Associations strongly believes that the most cost-effective way to sustainably solve today's health problems and health system challenges, achieve UAC and the health-related sustainable development goals is through primary health care. There is an urgent need to invest in research and development of technologies and procedures that bring the healthcare systems closer to the population. Implementing telemedicine and e-monitoring, community-based laboratories, rapid diagnostic tests would enrich healthcare service delivery, improve the quality of the services and patient safety, and increase the efficiency and coordination of care. One area that would benefit hugely from such an investment would be the rural areas. With adequate enough tools, a majority of diseases could be cared for in the community itself, thus reducing the sums spent on, for instance, transportation and hospitalization. Moreover, shifting tasks from physicians to nurses, from specialists to general practitioners would save not only time, but costs as well. We consider that medical schools have the responsibility of offering high-quality primary healthcare placements and of encouraging national and international medical exchanges in this field. The IFMSA recognizes that potential initiatives that governments could develop would be to offer loans for students who pursue training in primary care, scholarships for young doctors training in primary care, and ultimately increase remuneration for primary care physicians and rural practitioners. IFMSA congratulates the health community for the Astana Declaration. Nonetheless, it is of utmost importance to include all relevant stakeholders, including youth, who are the future health professionals and the forefront of our health workforce. Realizing the potential of the younger generation will act as an accelerator to implement robust primary healthcare systems and reach UAC by 2030. We urge future initiatives not to forget the role of young people as an equal partner across all stages, from identification, analysis, and design to decision-making and implementation. People-centered health systems are one of the 4 pillars of the Health 2020 initiative. We invite the European community to work together to reach our destination. Thank you.
Thank you very much. And now I give the floor to the Association for Medical Education in Europe.
Distinguished Chair, Regional Director, and delegates. This statement from the Association for Medical Education in Europe, AME, is supported by students' organizations, EMSA and IFMSA. The currently presented progress report clearly indicates that we need to bring to our discussion the strong focus on strengthening and development of the European health professions education. To achieve the universal health coverage for the European region, the effective interprofessional practice needs to be built on strong foundations of the modern and innovative interprofessional education. Moreover, both this report and the paradigmatic change towards the concept of One Health, including the well-being of people, animals, and ecosystems, indicate a strong need for widening the approach to interprofessional practice and education and bringing the other sectors to the really inclusive interprofessional and not the narrow intra-professional education, with the special stress on communication, intercultural competence, and obviously on digitalization. The main goal of this statement is to emphasize the importance of the active involvement and cooperation of present at this meeting stakeholders of the primary health care in influencing and shaping the development of under- and postgraduate interprofessional European curricula, ensuring that all complex needs of the European society are covered by the collectively exhaustive and mutually complementing competencies of health professions. Summarizing, from our perspective, the WHO Regional Committee for Europe is the key stakeholder of the European health professions education, and AMI is committed to actively collaborate with the WHO member states and non-state actors as partners in constant development of qualifications of the European health workforces. Thank you for your attention.
Thank you very much, and I give the floor to the International Pharmaceutical Students Federation.
Dear Chair, honorable delegates, it is my great honor to speak on behalf of the International Pharmaceutical Students Federation, which represents over 350,000 pharmacy and pharmaceutical sciences students and recent graduates in over 90 countries worldwide. Ensuring quality and essential healthcare services and use of safe, effective, and affordable medicines for everyone through the integration of technology is required to accelerate primary healthcare in the European region. However, these efforts should always focus on guaranteeing equal rights to every human by preventing the risk of financial hardship and increasing the accessibility of healthcare to all groups within society. Monitoring of health systems performance through high quality and integrated data and with appropriate technology is needed to ensure better services, increasing system responsiveness and patient safety. Citizens should play an expanding role in their healthcare and in identifying their health needs. Therefore, IPSF highlights the importance of appropriate education for healthcare students on digital health to improve healthcare practices worldwide. For several years, IPSF has been advocating for primary healthcare and the impact of technology in achieving such aims. Pharmacists must be involved in assuring the availability of good quality, accessible health services and medicines for everyone. IPSF encourages the advancement of effective information systems to allow optimal performances of health systems and be crucial in achieving better outcomes in health and health for all. Moreover, we are calling on the youth of today, pharmacists of tomorrow, to acknowledge the importance of staying professional and competent in this field. The Federation is supporting the development of digital health and pharmacy innovations, and is committed to bringing future generations of pharmacists closer to the patients for a safer and more effective treatment. To conclude, IPSF calls the Member States to support the primary healthcare focal points emphasized by the Astana Declaration and urges them to identify the technological and organizational reforms needed to accelerate primary healthcare in the region. Thank you.
Thank you. We reached the end of the speakers, and now please, Dr. Severoni and Dr. Johansen, please give the necessary answers as fast as you can.
Thank you, President. I'll try to be very short. First of all, I would like to thank all member states for the enormous amount of information updating on the tremendous progresses, confirming the tremendous progresses in promoting primary health care in this region. This is a fact, as I said before in the opening. Thank you for your remarks, but even more for your recommendations of what need to have additional intention, despite this has been identified and reflected in the report. The comments received also are an important motivation and source of inspiration to continue unfinished business or a business ongoing, I would say. It is clear that health systems need further intensive technical assistance in all our member states and alignment of different components of health system in order to expand not only the availability of services, but also, and we hear very loud, Slovenia and Moldova, the equity of services, the affordability of services, and always in a spirit of financial protection. And those are elements of work at the heart of our division. The region also shows to have an extremely strong, powerful network of private healthcare providers, which for us are elements of inspiration for support to countries, but also to share good practices and experiences. In fact, in the report, we highlighted as a first element of regional office support or action is the continued technical assistance to our member states. And we are counting a lot on our GDO in Almaty. This is a young office, only 3 years. All this that we've been hearing today is the result of collaboration, support, interaction with all member states in these last 3 years only. And a tremendous amount of technical assistance has been shaped, or engagement with all of you, all member states, has been promoted through this preposition capacity, specialized capacity present at the GDO. I also like to comment the remark made by France and also Slovenia about the importance of partnership and knowledge. This is also very central in our action. Again, the sharing of knowledge, sharing of good practices, facilitating interaction among countries is an essential element to progress in relation to improving primary care situation approach in our region. Again, we are counting, based also on the experiences of other GDOs, on the action and capacity that the GDO can promote in terms of setting up networks for knowledge sharing or even specialized courses, as we've been hearing today is the case of our offices. The partnership is central. Partnership is central, and is central in the work of the division, is central in the work on health system, in the action in achieving universal coverage, not only with a healthcare expert, but also beyond the health sector. And we are continuing to work in that direction, but also I'm taking with a big attention and care your recommendation in this regard. There were a number of comments related to the need of research and information. Indeed, this is central. The office in Almaty set up a framework to monitor progresses. We are looking at a close observation of what's going on in our member states. Indeed, additional research is needed. Indeed, additional evidence is needed. Indeed, we are still lacking single set of data and evidence which can support solid policy formulation or decision making. So we realize that this is an extremely sensitive area where we need to intervene. That's why in the report we thought important to identify digital pointers in order to really explore all possibilities, also to set up and to feed the need of information for the monitoring. There were a number of comments related to digital health. Thank you for that. This is not only a priority area for the division of health systems and public health, not only a priority area for primary care, not only an essential instrument for primary care to progress, but also is on top of the agenda, I would say, of all our member states, with a very, very attractive and stimulating reality in this region, as we have seen in the symposium this year, with member states already among the most digitalized member states of WHO, and countries, member states, which are investing now in scaling up their own capacity and really looking at existing experiences. In this regard, we also heard very, very well your comments related to the need of regulatory, normative, and governance related to the proper governance related to this element. IOM was bringing up the need of pay attention to group in condition of vulnerability, of course, migrants as a first, this is a very dear issue for this office. Not only because this office has been devoted a quite good deal of energy in really avoiding that migrants are forgotten in the discourse related to the progress of health system and primary care, but also because, and we reflected in the report, in order to have to defend the concept of equity and to have a proper development of primary care in our region, we need to pay attention to the demographic changes present today in our region, which are not only migrants, but also other group in condition of vulnerability or minority. I'm concluding. The call of linking the action to non-communicable diseases from the Association of Dietologists. It's central. This is we had an high-level meeting, a regional high-level meeting in Sitges, exactly to reaffirm the commitment to work in this direction. A lot of actions it's ongoing today, promoted by the division and by the GDO in Almaty, together also with the office in Barcelona. And with the colleagues of the non-communicable diseases, because the epidemiological shift is certainly confirmed by the data and situation today available. Thank you very much, President.
We thank you very much. With a great thanks to our interpreters, I please ask them to stay for 5 more minutes just for what we're going to do next. So, now we should consider the proposed draft resolution on accelerating primary health care strengthening. As I mentioned earlier, the document in front of you is the result of informal discussions between the Member States and the Secretariat. Only received this document recently. So, I would like to ask the rapporteur, Ms. Eva Franelik, to read it out in full. Please.
Thank you. Draft resolution accelerating primary health care strengthening. The Regional Committee recalling the global commitments regarding universal health coverage in United Nations General Assembly Resolution 67/81/2012 on global health and foreign policy and in General Assembly Resolution 70/1/2015 adopting the Sustainable Development Goals, SDGs, recalling the International Conference on Primary Health Care held in Alma-Ata and the commitment made there to primary health services as a measure towards health and well-being of population. Welcoming the convening of the Global Conference on Primary Health Care from Alma-Ata towards universal health coverage and the Sustainable Development Goals, Astana, Kazakhstan, 25th-26th October 2018, during which member states renewed their commitment to strengthening primary health care, taking a whole-of-society approach as the cornerstone of sustainable health system that provides universal health coverage and of efforts to achieve the health-related SDGs, in particular target 3.8, achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Recalling Resolution WHA 72.2 of the World Health Assembly on primary health care, which welcomed the Astana Declaration and requested the Director General to develop, in consultation with Member States, an operational framework for primary health care for consideration by the 73rd World Health Assembly. Reaffirming the 13th General Programme of Work 2019-2023, in which primary health care is noted as being an essential platform for the pursuit of universal health coverage and the SDGs. Valuing the long-standing tenets of health system strengthening in the WHO European region, as enshrined in numerous commitments over the years, from the Ljubljana Charter in 1996 to the Tallinn Charter in 2008, as embedded and expanded on in Health 2020, the European Health Policy Framework, which includes people-centered health systems as one of its 4 pillars, and as endorsed in the following regional committees' resolutions. EUR/RC65/R5 on priorities for strengthening people-centered health system 2015. EUR/RC66/R5 on the European Framework for Action on Integrated Health Services Delivery 2016. EUR/RC67/R5 on a framework for action to achieve sustainable health workforce in the WHO European region 2017, and EUR/RC68/R3, which reaffirmed commitment to health system strengthening for universal health coverage, better outcomes, and reduced health inequalities 2018. 1. Expresses its continued commitment to the values of solidarity, equity, and participation as enshrined in the Tallinn Charter and Health 2020, and the foundations for strengthening health systems based on primary health care and for pursuing universal health coverage with particular reference to SDG Target 3.8 on universal health coverage. 2. Urges member states, footnote, and the regional economic integration organization as appropriate, A. To prioritize the implementation of a primary health care approach in strengthening the health systems, including universal targeted health promotion and disease prevention, treatment, rehabilitation, and palliative care through the life course. B. To place people at the center of their health systems by focusing on identifying health needs and tailoring service delivery interventions to proactively and equitably respond to these needs throughout the life course. Engaging with and providing appropriate information to and education for their populations and to individuals to ensure that they are able to take control on their own health, and ensuring continuity of care in health service delivery within and between the different levels of specialization of care, as well as by other providers of care, including social services and private sector. C. To proactively measure and monitor the impact, performance, and capacity of primary health care to meet the health needs of the population and contribute to the strengthening of health data and information at national and regional level. D. To advance as appropriate within national contexts the implementation of the 10 evidence-based high-impact actions, policy accelerators for strengthening primary health care as set out in document EUR/RC69/13 Rev 1. E. To promote as appropriate within national contexts the integration of health and social services at community level. F. To ensure that the primary healthcare workforce has the knowledge, skills, competencies, and capacity and is sufficiently empowered to take timely and effective actions in order to improve the responsiveness of the health systems to the needs of individuals and of the population. G. To take action to empower patients and carriers to engage in joint decision-making in treatment and care-related issues, including throughout creating favorable conditions and providing training and assistance. H. To accelerate the uptake, implementation, and scale-up of digital interventions. I. To actively participate in the global consultation for the development of the operational framework for primary health care. 3. Requests the regional director to support member states upon requests in improving and strengthening the delivery of comprehensive primary health services in line with national conditions and needs. B. To strengthen the measurement and monitoring of primary health care impact, performance, and capacity across countries, signal opportunities to accelerate improvements and identify proven policy options that can be shared among countries. C. To strengthen partnership and knowledge sharing with the support of WHO, collaborating centers and think tanks, universities, universities and academics, and facilitate dialogue between professional association and patient organization, governments, and other stakeholders. D, to strengthen the capacity of the regional office on primary health care in alignment with the implementation of our 13th General Program of Work across the organization. E, to encourage the participation of member states in the global consultations for the development of the framework for primary care. F, to report on this resolution together with resolution EUR/RC66/R5 to the 70th, 75th, and 80th sessions of the Regional Committee.
Thank you very much. Thank you very, very much. And now, is the committee willing to adopt this draft resolution as just read out by the rapporteur by consensus? I see no objections. The resolution is therefore adopted.